All right, hello, good afternoon, everyone. We're going to go ahead and get started today. My name is Brooke Finley, and I will be your technology host for the webinar this afternoon. I will be here behind the scenes to make this next hour as rewarding and enjoyable for you as possible. Thank you for joining us during your lunch hour for our special webinar, Redefining Value, Healthcare Behind the Numbers. This is the third of a quarterly series of webinars that we've been putting on to share the latest trends that we face in healthcare and the innovations to deliver better quality, affordability, and an exceptional experience. Today, we hope that through this interactive webinar, you will gain a broader perspective of what is driving the healthcare economy and how you must derive the most value from it for real people, your employees. Now, before I introduce our presenters, I have a few housekeeping items for you. This is an interactive webinar packed with content. So in order to get the most of this hour, I just want to remind you that you may want to turn your cell phone off, close out of your email, and maybe change your instant messenger communicator status to urgent interruptions only. You may have noticed that we are using a new webinar platform for this session. Please take a moment and familiarize yourself with where the chat box is located. You will find that chat icon at the center bottom of your screen. If you click on this chat icon, a panel will appear on the right side of your screen. To minimize disruptions, we place all callers on mute, so be sure to send your questions via that chat feature. We expect a lot of questions, so go ahead and send them in as soon as they pop up, and we'll take all your questions following the presentation. And also, backed by popular demand, during this session, there will be opportunities for you to win one of three, yes, that's right, three $25 Starbucks gift cards. So be sure to pay attention and be ready for when those opportunities arise. Also, at the end of today's webinar, you will be prompted to take a survey. This could also earn you a chance to earn a Starbucks gift card, but most importantly, your feedback really helps us know how we did so that we can improve for the next webinar. Today, we have two presenters to take us through this special webinar. We have Bryony Wynn, the Senior Vice President and Chief Strategy Officer at Blue Cross and Blue Shield of North Carolina. But first, we're going to hear from Steve Christ, who is our fearless leader of major group sales and marketing here at Blue Cross NC. So now, Steve, I want to take a moment to make sure this is really you, because I understand you have an identical twin brother.
Hi, Brooke. That is true. Good bit of useless trivia. You know, when our kids were a lot younger, it made for some strange looks on their part for both him and me. Thanks, Brooke, for the introduction. And gang, good afternoon. You know, our webinars are designed to dig deeper into some of the challenges that our customers face and how those items guide the work that we do here at Blue Cross and Blue Shield. So with that today, we are thrilled to have Bryony Wynn bring this special presentation to you. As you can see from this next slide, Bryony Wynn is quite the world traveler, and I will also add that she has a very charming accent. A native of Zimbabwe, Bryony earned a master's degree from Rhodes University in South Africa. She then moved to the United Kingdom as a Rhodes Scholar at Oxford, earning another master's in international development. Joining McKinsey & Company in 2009, Bryony spent the first decade of her career providing strategic and operational counsel to a wide variety of clients across Europe and Africa. She relocated to the U.S. in 2011, where there as a partner in the McKinsey's Chicago office, she advised healthcare CEOs and state leaders on how to improve systems of care and payment transformation. Just last year, Bryony joined us here at Blue Cross and Blue Shield of North Carolina as our Chief Strategy and Innovation Officer, where among other things, she is responsible for guiding the company's long-term strategy. Earlier this year in March, Bryony was one of 127 people in the world named to the Forum of Young Global Leaders by the World Economic Forum. And more recently, just 2 weeks ago, in fact, she was named by Modern Healthcare as one of 25 emerging leaders nationally. Bryony, I will say that's quite a pedigree. Congratulations. To give her view about redefining value in healthcare, please welcome Bryony Wynn.
Steve, thank you very much. And I can certainly give you pointers on all of these countries, but probably most importantly, where you get the best food. For those of you who don't know where Harare, Zimbabwe is, don't worry, because until about the 18 months ago that I joined Blue Cross North Carolina, I couldn't have told you where Durham, North Carolina was either, so we can call it even. Thank you so much for having me today, and looking forward to speaking with you all. I wanted to start at the highest level, which is, as you'll see on the slide, what value means to us at Blue Cross North Carolina. I have no doubt when you have talked to anybody in the healthcare industry, value is top of mind. To be honest, it is the central square of any buzzword bingo for the healthcare industry at the moment, along with AI and social determinants of health. You will hear it a lot. But what is less clear is what it actually means and how it's going to change the lives or impact the lives of people who actually pay for healthcare products. And so wanted to share with you a little bit of the overarching thesis of how we think of it at Blue Cross North Carolina, which is the equation you'll see on the screen in front of you. Value is a combination of the return on investment, because clearly we can't invest money, like any business, into things that aren't sustainable. There is a multiplier by return on health, which for me is the quality indicators and the actual health outcomes that our members receive when they get care. And that's incredibly important. You don't want to only invest in things that will provide economic value if it actually provides no health value. And then an additive of experience. And to be honest, I would love to one day make that a multiplier too. But as you have probably experienced, experience as a consumer in the healthcare industry is really terrible. And so let's start with getting slightly better and go from there. And so that is how we see value as a company and what we're trying to get across to you, our customers, in meaningful ways. And this is a very practical type of equation for us. We look at it when we are thinking about new products, when we're thinking about investing in capabilities that will make a difference. We ask ourselves quite purposefully these questions. How sustainable is it, and will it provide an ROI? What are the health implications for you and your employees? And then, can we do this in a way that is frankly less arduous and confusing and deliver a better experience for you? Start at right at the top. $3.7 trillion is how much is spent on healthcare in the U.S. annually. That is pretty incredible. It's actually hard to conceptualize how big that number is as an industry. So let me put it into perspective for you. For $3.7 trillion, you can buy Amazon, Apple, and Microsoft in cash and have $1 trillion left over. This is about 18% of our entire country's GDP. Think about that as 1 in every 5 people you know is likely employed in the healthcare industry. If you have children going to college or thinking about, MBAs afterwards, 1 in 5 jobs in this country will be in healthcare. What is particularly interesting as well is, as an industry, regardless of financial cycles, jobs are added in healthcare. So even during economic downturns. This is hugely problematic for the other side of the equation, which is the cost of healthcare to consumers. Let me tell you a little bit about that and where this $3.7 trillion comes from. $1 trillion is paid by individuals, people like you and me, when they receive care, in premiums, in out-of-pocket costs. About $900 billion across the country is spent by employers. And $1.6 trillion is actually paid for by the government. And I think this, these kinds of statistics are quite instructive for a number of reasons. Firstly, it is an incredible out-of-pocket cost for individual human beings. That is at least $1.9 trillion. The other thing that is instructive is, and I can say this not coming from here, but Americans have a lot of political debate about the role of government in healthcare and if we want to be a government-run system. But what is actually truthful here is the government pay for over 40% of healthcare anyway. And the lesson that is, for me, is if we don't fix it as an industry and even, smaller as a company, the government will step in and do it for us. And I am not convinced, having worked in a number of public systems, that that is the best thing for businesses and consumers overall. So there is an imperative to get this right. And it's not as binary as saying, oh, should the private sector lead healthcare or should the government? Because as you can see here, it's a mix already. This is a little bit of a detailed slide, but wanted to give you a view of the macro level of where this money goes. So about a third of what consumers pay, right up there at the top, goes directly to providers, to physicians, to hospitals and pharmacies. This is both in the copay costs you have if you are insured, but also if you do not have insurance, what you pay directly for care. 2/3 of that go through payers like us for people who buy products individually. So think of these as ACA or Obamacare plans. Employers like yourselves pay for care in two ways. Predominantly, it's all through an insurer, and some of that is self-insured, where we charge you an admin fee, and the rest goes through to the provider, and the rest is fully insured, where we take on the risk for you. And then the government portion comes through a number of areas. So Medicare Advantage, Medicaid, which is of great political interest in North Carolina at the moment, and then government programs. So think of these as programs like the VA or the state healthcare program, federal employees. And then the $250 billion in gray in the bottom is actually research costs, so things that they help to develop new drugs and some pharma research. What does that mean then in who gets the profit from the business end of healthcare? And this I find really interesting as well. So this is a distribution of the healthcare EBITDA of the entire industry. So think the EBITDA or the profit of the $3.7 trillion across players in the industry in 2016. This is due for a refresh, and we'll do that for you, but the numbers haven't changed much, with the exception of pharma being a slightly higher percentage of that pie. But what this shows is 9% of the whole profit goes to payers, broadly. That would be us, and the other sort of commercial payers. It also includes pharmacy benefit managers or PBMs. 54% of the entire profit of the industry goes to providers, and the bulk of that, and I'll show you on the next slide, is to systems, hospital systems. 4% of this goes to service vendors. Think of these as IT and other data analytics vendors. Think of these as the brokers who work for you. And then 33% goes to manufacturing and distributors. And that, as you'll see on this eye chart a little bit, is predominantly pharma and biotech, but also a bit of medical devices. The way to read this chart is the size of the box is equivalent to the amount of profit made by each of the players on the slide. And so what you can see, and this is a little bit going back to my thought about what government healthcare could mean, is even if you eliminated the entire first column of payers, it's actually not going to significantly move the needle on healthcare costs in our country. The strategy needs to be bigger than that. This is not as simple as eliminating any one of these boxes from the entire industry. It needs to be a much more thoughtful and integrated solution. And frankly, as an industry, I don't think we've been great at that. I have long said I feel a bit sorry for employers because I think we have forced you all to be experts in the healthcare industry, and yet no other provider of consumer services forces their consumers to be experts. I do not have to know about engineering to work my iPhone. It just works. And I would love to be able to do that for you too.
Yeah.
Couple of things here, and we'll talk a little bit about this as we go through. But we as North Carolina have started our strategy in that provider bucket because that 54% is addressable spend that we more directly control for you. You know, I see us as a front for 3.8 million North Carolinians, and it is our job to collectively bargain with hospitals better for you for that money. The next tranche of the work we're going to do is really thinking about how to get value in pharma and biotech as well with that 33% trunk.
Okay, so a quick poll question here, and this is your first chance to win a $25 Starbucks gift card. So get ready to answer as soon as these poll questions come up for you. But our question here is, how much of total household income do Americans spend on healthcare every year? So go ahead and start answering that poll. Looks like we've got a large portion that have already voted already. So far, it looks like most folks are choosing 30%, but the other options are 10% or 50%. What do you think? We've got about half of you or so that have voted. I'll give you just another moment. All right, we're going to go ahead and end the poll, and we're going to share those results with you. It looks like 73% of those of you who answered selected 30%. What do you think about that?
30% is the correct answer, and isn't that crazy? That is a 30, no other portion of your life, not even house, rent or your mortgage, your housing, do you spend that much on healthcare.
Yeah. Bryony, to jump in, a data point for us in the account management world, when we do consults with these employers, on average, the member cost share, whether that's the employee or the dependent, is right now averaging 18% in the group health plan space. So you would couple the 18 plus arguably the 12 that perhaps they spend in the premium to get to the 30 when we talk about affordability. Here's another data point that we find interesting on my team is that there was an Oliver Wyman study not too long ago that the average commercial plan, so employer-sponsored health plan, the average commercial plan deductible for employee-only coverage in 2006 was $584, and in 2017, that average deductible had grown to $1,573, which paraphrased means that the deductible growth has been 8 times faster than the wage growth over that same time period. So I think it puts a finer point on both this poll and the comment that you're making around affordability.
Thank you so much, Steve. And that's exactly where we're going to go next. So if you take this macro perspective that I've talked about, as a country, $3.7 trillion, 1 in 5 jobs, and a whole set of an industry that is making profit. It looks like, in some ways, a decent news story. And certainly that's how the job growth is portrayed externally. But you bring this down to a micro level, and I've said it before, and I'll say it again. I think affordability in the U.S. is the public health crisis of our time. And the growth that Steve has talked about and the implications on individual human beings is what I mean by that. So take the family on the left. They are real customers of Blue Cross North Carolina. They're actually in an individual plan. This family and their 2 children spend 33% of their household income on healthcare every year, and they are insured. And that is just an unsustainable amount, particularly coupled with the growth of that over time and the growth of the underlying wage growth. I'd also want to add that this family dual income earns around $130,000 a year. So this is not considered a low-income family in North Carolina either. They are not alone. 29% of Americans report problems paying their medical bills. 17.9% of our entire country's GDP is spent on healthcare and growing. And 13 years in a row, nationally, large group plan costs have increased by more than 5%. There is pretty much no other line item on any employer's balance sheet that grows at that rate. And there are a whole lot of stats that we can bring out, but one of the most staggering for me is Starbucks spends more on healthcare costs in the U.S. than they do on coffee. So they see that as their biggest budget item. Talk about another strategic issue at the personal level that we're addressing. This is Penny. Penny is another Blue Cross of North Carolina customer. She has been a customer from her parents' group plan basically since she was born, and was first really introduced to us when she was about 12. Penny had suffered from ADHD and a whole bunch of diagnoses at school, and really struggled with sort of concentration and then truancy at school. She describes her life to us like she felt like she was a cross between a human pincushion and a ping pong ball. She was tested on medically, behaviorally, between psychologists, psychiatrists, the medical community, school counselors, to try and treat her depression and ADHD. She was bounced around to lots of parts of the system. She dropped out of school at about 16 and started drinking. She talked about it as self-medication. She couldn't deal anymore with the medical system. And so at about 19 or 20, started taking drugs. And we discussed, or you met Penny properly and had this conversation with her after her second stint in opioid use treatment. Mental health is another incredibly important part of what it means to add value in healthcare. And seeing people like Penny as one person, one human being, one customer, as opposed to how the healthcare system has traditionally treated this, which is medical care is on one side of the fence and mental health is on another. Penny is not alone. 20% of Americans experience mental illness in a given year. So again, go to any conference room and 1 in 5 people in your row is likely to experience mental illness. Interestingly, when we run the data on this, there is no difference between our commercial population, so the employed population, in this statistic, as there is of Medicaid. And I think this is another sort of misnomer in the healthcare system, is that it is more likely to be elderly people or poorer people, people on benefits that experience mental health crises. Is actually not true. This is staggering to me. substance abuse ranks #1 in terms of cost drivers in the emergency department for Blue Cross North Carolina. More people are likely to go to the ED for substance use and spend significant amounts of money afterwards than anything else. And this is as much a social phenomenon as it is a medical one. And here is the slight good news story, at least for me, is that $10,500 a year is the additional annual cost for individuals with untreated behavioral health needs. And the reason I see this as somewhat heartening is to go back to the value slide that I talked to you about. There is a real ROI from an economic perspective of helping these folks get better care. So there is clearly a health imperative and a moral imperative. But actually, if you can provide great care for less than $10,500 a year, you are also going to save money. And that's quite something. Another interesting piece of customer to talk to you about. Meet Bruce. Bruce is the one who looks less awkward in the hard hat there. He has worked in Eastern North Carolina his whole life. He is employed by a construction company, and for his entire working life has been a Blue Cross North Carolina customer. This is a much happier story than Penny. But one of the things that Bruce talks to us about a lot is how he actually doesn't understand what makes him healthy or not healthy. And he gets pinged both through his employer and through Blue Cross by a plethora of different solutions. He also gets, interesting information from the internet. His wife does from her Weight Watchers group, and throughout, all the different facets of his life, he hears things about what health means and doesn't actually know how to put this all together. Where you work matters. So 63% of employees are satisfied with their health plan. That's, for me, really low considering how much is spent by employers on healthcare in general. And one of the top reasons folks cite is complexity. I actually don't understand how to work the system. The other point is 70% of health outcomes are determined by non-genetic factors. And this is incredibly important as we look at the $3.7 trillion spent. It means that you can control 70% of this. And this is a real opportunity for employers. It is a real opportunity for us as a healthcare industry, is saying, what does controlling this mean? And clearly, eating and exercise are part of it. But there is there's a huge amount of research into workplace environment, cultural factors, what your office spaces or working environments look like that contribute both to physical health and to mental health. And here's one, to be honest, that I tease Steve about quite a lot. In our look across the industry at the moment, and just in the employers that we work with, and this is not all through Blue Cross North Carolina, I'll happily add, is that collectively you all use 5,000 point solutions spanning 100 categories to ping your employees with.
Let me jump in. For those on the phone, the definition of a point solution there might be a unique provider or a vendor of a service that might say speaks to diabetic management or a telehealth service. So just to unpack that definition. A couple more comments, Bryony. Gang, I use this statistic a lot because it just really drives home the point of how important your role is as an employer in the healthcare space. Specifically, 155 million Americans get their health insurance coverage through their employer. So if you ever had a question of how important your role is, let that statistic be your defense. One other thing that we are particularly focused on here at Blue Cross is we understand that right now it's a tight labor market and that talent acquisition and talent retention are very important to you as an employer, and that your benefit plan is an important tool in that pursuit. But we also want to ensure that your unique group's characteristics are addressed. And so the problem here of this landscape having 5,000 solutions across 100 categories obviously is one that can be confusing. And yet we know that the health plan becomes this key point of integration for you. And so you would look to us to support this integration. I'll say this, at Blue Cross, we are committed to supporting you, and we view our role in this as one of vetting these different point solutions, and if we find value in them, then we will go ahead and incorporate and integrate them into our market offer. So that is our commitment to you as our customer.
That integration point that Steve mentioned is incredibly important here. One of the things that I joke to startups about a lot when I speak to them, and these are often the folks who are, vending these point solutions, is why would we ask one of our employers to put money on the line when they are self-insured to work with you if I am not confident doing it for our fully insured members on the other side? Yeah. And they often find it easier to go directly to you and sell something, or they did historically, less so now. And I think it is instructive that, our entire business is managing the risk, and we're not confident using some of these folks. And so, to Steve's point, we are more than happy to help you understand where we think the value is for each one of these.
All right. So it's time now, again, for additional poll questions. So get ready for yet another chance to win your $25 Starbucks gift card. We're going to go ahead and launch the second poll. And the question you're answering here is, what do you think about pharmacy costs? So pharmacy costs represent about what % of total health plan costs? Go ahead and log your answers in. We see a lot of answers coming in. The majority of folks are choosing 30%, but we also can choose between 20 and 10%. So let us know your thoughts. We got about a third of you, quickly approaching 50% that have voted. Leave it just another moment. Get your last votes in, your chance to win that gift card. All right, we're going to go ahead and close out the poll and share the results, and it looks like a majority have chosen 30%. What do we think about that? Yes, an educated group today. That is exactly right. About 30% of our medical cost base is attributed to pharma currently. And let me talk to you about another customer of ours who actually used to be an employee of one of you folks on the phone, but is now more recently a Medicare Advantage member with us. Meet Harold. And Harold talks about his relationship with pharma in mostly very positive terms. He's actually a vet and returned from 2 stints overseas with quite some gunshot and then shrapnel injuries, and believes without the collective power of pharmaceuticals, he would have died twice. He is a well-managed diabetic, and has luckily had access to insulin and the right medication over the last 15 years, and is expected to for the next 30 to 40 of his life, hopefully. And then he also laughs at the number of vaccines he's had in his life, and the extent to which, certainly when he was overseas, he saw the implications of people who hadn't had access to that. However, he does, as you can tell by the quizzical look, get frustrated both by the cost and the amount of drugs, etc., he has to take. So, Harold, too, is not alone. 30% of our cost base is attributable to pharma.
And this is incredibly important for the next stat here, is that it is growing at more than double the rate of anything else. So our 4-year growth rate of drug spending for Blue Cross North Carolina is 9% versus inpatient, which think of that as systems, or outpatient, being more physician offices, has been 2 to 4% over that same time period. So in a world where affordability is the crisis of our time, pharma is one of the big drivers of that cost. And then this is the sticking point for me, is that the operating margin for the top 25 pharma companies globally is 22%. And that is disproportionately driven by the US. If you go to the top 10 pharma companies, you get just over 30% is their operating margin. I don't know how many of you make even close to that amount of margin in your businesses, but for comparison, Blue Cross North Carolina's 5-year average is 2.6. There are lots of reasons for this. I don't want to, simplistically underplay the value of pharma in our lives. I think it is incredible medical advancement. I also know, and when I have this chat with the pharma companies who we work with, and many of them are in the Triangle, they all talk about R&D and the relative risk of our investments, etc. I give some of that. I want to tell you that more than 60% of R&D for new drugs over the last decade has been funded by the government. So the idea that this is pharma companies, nobly taking all the risk is actually not so true. The other thing is many of these molecules now are invented in universities and in small labs and then acquired versus, systemic big company R&D. What this is saying more than anything else, I think, to me is it is very tempting to, in the short term, decouple medical and pharma costs, but in the long term, that is not going to be a helpful strategy for the industry as a whole, for 2 reasons. One is the adherence the adherence on your pharmaceuticals shows up in your medical plan, and to have, a single system controlling all of that is better. And then also because I think it is unlikely that individual companies, or certainly not individual families, are going to be able to work in a bulk basis on how to really move pharma from this type of pricing to value-based pricing. But we could.
Can I add one thing, and would you agree with this? Many of our listeners are familiar with our efforts around Blue Premier and how we want to have 100% of our provider partners, think health systems, physicians, and so forth, in a value-based arrangement with Blue Cross and Blue Shield. And one of the things that we are holding them accountable for is the total cost of care. And so if we were to separate medical from pharmacy, it's probably a difficult conversation with that health system or that physician group to say that total cost of care includes pharmacy, and then yet pharmacy is treated separately from the plan. Would you agree with that?
I would completely agree with that. And you may not care if it was 3% of total cost, but now that it's 30% of total cost and growing exponentially, you really care.
Yeah. Thank you.
So, I'll return to where I started here, which is we do have a real definition around value. And it is for exactly the reasons that we've discussed through this. I mean, some of these statistics are quite staggering. So we are committed, we're 2 years in, or almost 2 years, 22 months into our new strategy. And that value for you and for us is going to be return on investment. Can we make it sustainable? Meaningful return on health, and then a better experience with everybody we work with.
Okay. Well, thank you. We're going to go ahead and take some time for questions here. So if you have a question, feel free to submit that in through the chat box. And to get us started, we had a question come in. You mentioned there are a number of things that consumers care about, but what do they care about the most?
I can start this from a broad-based perspective, and then Steve, I'd love your thoughts on, the particular folks on the phone. There are 4 things that disproportionately come out in our research as things that consumers care about. And they're almost equally across the 4. So the first thing is affordability. Cost pressure in healthcare is the thing that they care about most. And both are you getting value from your plan, but also are the costs actually going to stabilize or decrease? The second thing is product. How can I use this? Can I use it where I want to? Do I have access to the doctors I want to go to? But also, do I understand all of that? The third piece is operational efficiency. Hey, can I look up what I need to on your website? Can I call you? And do I get through? And then the fourth thing, interestingly, is consumers really care about, what we bucket overarchingly as reputation. But it's, do we believe that you are trying to do the right thing? Do we believe that your incentives are aligned and that we're working together to fix the system? And that has come out really strongly in the research we've done as well.
I would add, from the lens, the question was consumers, Brooke, and I'll tweak it to say customers. In our travels, our customers, so think of that being you as decision makers and employers, first and foremost are focused on affordability, both for themselves as a health plan sponsor, but also for their employees and the dependents. And then the next subject is one of engagement. I was encouraged to hear you say, and how they would unpack that is certainly help my employees understand their benefit plan. But they would also take it a step further, and I applaud many of you on the phone, help them be better consumers. And that has as a derivative, make me a better shopper of healthcare where it's appropriate. So I can't necessarily shop if I have an emergency situation, of course, or maybe something as super complicated as cancer or oncology, but about elective procedures. So think orthopedic. Blue Cross, help me as an employer educate my employees and their families on, can I be a better consumer? Can I be a better shopper? And I think that helps with the understanding of just how expensive healthcare can be.
Great, thank you. We've had another question come in. Do you think CDHPs are effective or as effective as we'd hoped? So kind of right along the same lines there.
Yeah, it's a great question. I think the crux of that lies in the second part of your question, as effective as we'd hoped. I was always surprised with the amount of stock that employers in particular thought CDHPs would drive. So my answer is yes, they are effective, and data proves this out. They're effective in the sense that they overarchingly do help people understand more the context and value of what healthcare costs. But for the reasons and the breakout of EBITDA that I showed you and talked about before, if 54% of that lies with providers and 33% of that lies with pharma, no individual consumer can control 88% of the industry.
Yeah.
This is a business-to-business discussion. And so it always seemed a little crazy to me that we thought by putting individuals on the hook, we were going to truly stem the tide of healthcare cost. I'd say 2 other things is plan design is incredibly important here because there has been a bit of a backlash against less well-designed CDHPs where healthy people have avoided primary care. And we've seen actually cost rise in employers who went that route because people would wait until more emergency care before receiving treatment. And then the second thing is folks like predictability, sometimes over affordability, and it's nice. There are many employers, and like Blue Cross North Carolina is one of them, who is offering both. So from a fully CDHP program, next year we're returning to primarily CDHP, but with a broader PPO, less high deductible option.
That's right.
Great, thank you. There's still time for another question or so, so feel free to chat that into the chat box. Bernie, I wanted to ask, of everything that you're working on, what are you most excited about?
Yeah, so I mean, for me, and I think it's come out here, I really care about affordability. That is the crux to making this industry sustainable and what that means. And we have recently, or over the last year, been working on both a definition of affordability and being able to measure it. And what we are doing is looking at, simplistically, total out-of-pocket costs for a member and an employer divided by wages or salaries. And that gives us a percentage. And what we're saying is anybody who spends more than X percent, make it 20% of their annual income on healthcare, that is unaffordable. And what we've started to develop is a dashboard for all of you, if you'd want to look at some of this data with us, that says on your entire panel of employees or entire slate of employees, how many of them are spending over 20% of their income? From your income data and our claims data, how much of them are spending over 20%? It's super instructive. We actually used it in the redesign of Blue Cross North Carolina's health plan last year. And it shows that does this impact, one set of employees over another, low income versus higher income, families, people who are buying CDHPs versus PPOs. It really helps in the plan design, and I think it's making it very practical of what affordability means for you and your employees.
Let me add to that. At a macro level, I think Blue Cross, we've done a good job of addressing affordability through reduction in premiums, most notably in the individual market with the ACA plans, in the MA, Medicare Advantage, senior market for those plans. And I'll say specific to many of the audience here on the phone, in the group space, in the commercial employer space, if you haven't heard already, we announced a new value-based care product in the Triad market with Wake Forest Baptist Health that looks to decrease premiums by as much as 15%. If we can steer care and incent care to the Wake Forest Baptist Health system, there's some long-term impact to how that system manages care in that region and for that specific population. Now, to the point about consumer-driven health plans, this product may not be for everyone, but we do, it covers an 8-county region, and we have high hopes that that model of a system-specific, co-joined, locked arm with us in terms of having a shared vision of how to control healthcare costs, that model will also pop up in other markets across the state and, frankly, across the country. So if affordability is the North Star here, which it is, these are practical, tangible examples of how we're making that real for our customers.
Great, thank you. All right, we've got time for one more question. We've heard some chatter around Medicare for All, but what are your thoughts around that?
This is another tough one in a very mixed, polling on this in North Carolina. So I'm going to take this from a totally sort of societal and business perspective. I think pragmatically it's unlikely to happen. Certainly not in the next election cycle. But I do think we have to go back to why is this even a discussion? And this is a discussion because hardworking families, the Joneses who I talked about before, who earn $130,000 a year, are spending 30% of their income on healthcare and feeling like they're not getting a great deal for it. It's also happening because the government is spending $1.6 trillion on healthcare already. And so whether the actual policy comes out or not is, I think, less material than the challenges that are driving it are very real. I think overarchingly, it would not be a great thing for the country to have this amount of care determined at a federal level. But on the other hand, I do think if a collaboration of you who insure 155 million Americans, the payers and the providers don't get our acts together and really meet consumer needs, I do understand why the government might feel there's no other role for them but to step in.
All right, thank you so much. We're going to keep moving on so we can have a moment to wrap up. Bryony, a few closing comments from you.
Well, thank you very much for joining us today. I hope this has been useful to you. I found it's incredible how people who are involved in healthcare every day actually don't have a broad view of the industry as a whole. And so that's a little bit what we strive to give you here. And the kind of factoids that actually change human behavior, but you don't even hear about every day. We're happy to, I'm more than happy to answer questions, and you know how to get in touch with the team if you have any for us. And then as we've got there, feel free to follow me on Twitter. I share some of the same candid opinions I shared with you today there.
That's great, thank you. Okay, so just to wrap up, in this webinar, we reviewed how healthcare affordability is the crisis of our time. More than 26% of Americans report having trouble financing their medical bills. Beyond cost, we have a moral imperative to really deliver improved health outcomes and provide a better experience. And to truly fix healthcare, insurers and employers alike really need to focus on what matters the most, and that's individuals and the real-life problems that they face. So as we wrap up, I want to remind you to please reach out to your Blue Cross sales representative to find out more about specific solutions for delivering more value to our employer clients, their employees, and their families. And if you visit our microsite, you'll find some more information on innovations in healthcare. And when you complete our survey at the end of the webinar, you will be automatically directed to this website where you'll have access to a wealth of healthcare solutions and tools. And finally, we do want to thank you for joining us today. We truly appreciate your time and your survey feedback. Thank you.